All right. Hi, everyone. I'm Dick Hibby from State4 Therapeutics. We're a new Yale Ventures Blavatnik-supported spinout where we're really interested in the next wave of oral obesity therapeutics for improved quality and efficacy of weight reduction. We have a spectacular team. I'm an endocrinologist. I take care of patients with obesity, and together with Matt Marins and we're islet biologists with expertise in mitochondria. We have an obesity KOL, Anya Yastreboff, who's led the clinical trials that got the GLP-1s approved for weight treatment, and we're associated with a chemist at NCATS and a strong team with Anjali Kumar and Robert Williams. And I don't need to tell you about the excitement that there has been for treating weight recently. It's really stunning, but what I may need to tell you is where we really are with the best therapies. This waterfall plot's from one of the studies that Anya published showing the heterogeneity of response to tirzepatide. Now, the average weight loss was an impressive 22.5%, but to reach target, the average weight loss really needed to be closer to 35%. So that gives us about 10% of people who are actually making it to a normal BMI with these treatments. So there's a lot of room to move, and we have to recognize the heterogeneity and the insufficient responses. We have to anticipate the next wave, which is moving into orals, and the problem of weight loss, which is muscle loss. So why are islet biologists talking to you about weight? So GLP-1 was actually discovered for its role in stimulating insulin secretion. And what is known is that it does nothing without a metabolic response. So what Matt and I discovered was what that metabolic response is and how we target it, and we target it by activating pyruvate kinase. When we do this in the periphery, it has all sorts of benefits for glucose and lipid metabolism, and we see that there's a synergy between pyruvate kinase activation and these benefits. But obesity is a disease of the brain. We have to be able to get into the brain to treat this, and we have to activate the metabolic responses there. All right, so this is an example with our target compound, or our tool compound, where we see that the combination with liraglutide of our medication gives 85% more reduction in weight. Now, weight is good, especially if it's fat, but liraglutide leads to reduction in mass, as you can see in the white bar. And the PK activators actually increase lean mass. And together, the combination is muscle neutral. So we think that's really important. So our recent chemical breakthrough results in a strong lead candidate that goes in the brain and is downstream of all the targets that people are going after, and will amplify those. We have foundational intellectual property recently filed, and we know that this will work as monotherapy or in combination with other medications. So this is our pathway forward. We're 6 to 8 months from initiating IND-enabling studies. And if you're interested in the field of obesity and what activating a new target can do, please come talk to us. We're looking for about a $10 to $15 million seed that will get us through IND-enabling studies to clinical proof of concept. So thank you for your attention. We have a poster here today and tomorrow, and please come by and talk to us.